All right, let's talk about something that affects millions of people, but often without them even knowing it. We're diving into hypertension, or as most of us know it, high blood pressure. We're going to break down what it is, why it's such a big deal, and, most importantly, what we can actually do about it.
We're kicking things off with this because, honestly, if you remember one thing, it should be this. It's not just a catchy phrase. The silent part is exactly what makes this condition so incredibly dangerous.
So what are we really talking about here? Well, at its core, hypertension is just what it sounds like. The force of your blood pushing against your artery walls is consistently way too high. Think of it like the plumbing in your house. If the water pressure is cranked up to the max all the time, things might seem okay for a while, but eventually, that constant strain is going to cause some serious damage.
And that brings us to our first major point. That term, silent killer, is no joke. You see, you can have high blood pressure for years and feel perfectly fine. No symptoms, nothing out of the ordinary, all while serious damage is quietly happening on the inside.
This quote really lays out the stakes, doesn't it? This isn't some minor issue. That constant, hammering pressure puts a huge strain on your most vital organs. We're talking about a much higher risk for things like heart disease, stroke, and even kidney failure. This is exactly why getting it under control is so critical.
So if it's silent, how in the world do you even know if you have it? Well, it all comes down to the numbers. Your blood pressure is measured with two key figures, and once you understand those, you're on your way to taking control. So, let's crack the code.
Okay, so when you see a blood pressure reading, say 120/80, you're looking at two different things happening. That top number, the systolic, that's the pressure when your heart is in the middle of a beat, when it's contracting. And the bottom number, the diastolic, that's the pressure when your heart is resting between beats. And this right here, 120/80, that's pretty much the gold standard. This is what's considered a normal, healthy blood pressure. It's the baseline, the target we're aiming for. So what happens when those numbers start to climb?
Well, this chart breaks it all down. You can see that even being just a little bit above normal puts you in the elevated category. That's kind of the first warning sign. From there, it moves up into stage 1 and stage 2 hypertension. And way up at the top, you see hypertensive crisis. That's a flat-out medical emergency. The key here is just knowing where your numbers fall on this spectrum.
So this all leads to the big question, right? Why? What's actually causing the pressure to go up? Well, it turns out there are generally two main types of hypertension, and that helps us get to the bottom of it.
For the vast majority of people, we're talking a staggering 90 to 95% of cases, it's what's called primary hypertension. And here's the wild part. There isn't one single identifiable cause. It just kind of develops over time. Now, for that other 5 to 10%, it's secondary hypertension, which means it's caused by something else, like a kidney problem or a thyroid issue.
To make this even easier to picture, our source material has this fantastic analogy. Just think of your circulatory system like this. Your heart is the motor, pumping away. Your blood is the fluid in the tank. And your blood vessels, they're the pipeline. A problem with the motor, the tank, or the pipeline can cause the pressure in the whole system to go up. And even though we don't know the one single cause for most people, we do know the big things that contribute to it. It's a mix, really. Some of it you can't control, like your family history or just getting older. But there are a lot of powerful factors you can control, like your diet, your stress levels, and habits like smoking and drinking.
Okay, so if it's silent, how is it ever actually found? Let's talk about the symptoms, or more often, the lack of symptoms, and how doctors figure it out.
And I know I sound like a broken record, but we have to circle back to this. Because it's so often silent, a lot of people have no idea their blood pressure is high until something serious happens, like a heart attack or a stroke. This is why regular checkups are just so important.
But sometimes, especially when blood pressure gets dangerously high, the body does try to send out some warning signals. Things like really bad headaches, feeling dizzy, blurry vision, even nosebleeds. If you're experiencing any of this stuff, it's a huge red flag to get checked out by a doctor right away. Now, a proper diagnosis isn't just based on one reading at the pharmacy. A doctor's going to want to see multiple readings over time to confirm there's a pattern. They'll also probably run some blood and urine tests to check on your kidneys and other health markers, and maybe even do an ECG to check on your heart's electrical rhythm.
So why is getting that diagnosis so important? Well, it all comes down to preventing three major life-altering health problems that are directly tied to high blood pressure being left unchecked. Let's be really clear about what those are.
And here they are, the big three: heart attack, stroke, and kidney failure. This is the end game we're trying to avoid. This is why managing high blood pressure isn't just a suggestion, it's a necessity.
But, and this is the really important part, this is a highly manageable condition. So let's shift gears and talk about the clear, practical things you can do to take back control. The best strategy is a powerful 1-2 punch. It's not one thing or the other. It's combining meaningful lifestyle changes with medication if your doctor thinks it's necessary. The two work together to get the best results.
The first part of that punch is all about your daily habits. And these are things that make a huge difference. Just cutting back on salt, for example, helps your body get rid of excess water, which directly lowers the pressure in your arteries. Eating better, moving more, managing your weight, all of these can have a massive impact.
The second part of that punch is medication. Now, if lifestyle changes alone aren't enough to get you to your goal, your doctor has a whole toolkit of medications that can help. They work in different ways. Some relax your blood vessels, others help your body remove extra fluid, but the goal is the same: to get that pressure down to a safe level. So, to wrap it all up, high blood pressure is serious. It's silent, and it's all about the numbers. But the good news is, by understanding those numbers and tackling it with that 1-2 punch of lifestyle changes and medication, you can absolutely take control. Knowing is the first step. So the real question is, after hearing all this, what's one small, positive change you can make starting today?